welcome. Thanks everyone for being here. We're here to celebrate the achievement in the development of Restorative Care Village at the Los Angeles General Medical Center campus. This is a huge achievement. Before we start, I'd just like to give it a round of applause that we got to this point so fast and so quickly. Okay. The first thing we're going to do is we're going to invite Ari Ambulo Gutierrez to come and talk about the part of the Latino Equity Alliance to stage the lead in the county official land acknowledgement. Ari.
Oh, thank you. Okay, just making sure you can hear me. All right. The County of Los Angeles recognizes that we occupy land originally and still inhabited and cared for by the Tongva, Tataviam, Serrano, Kisa, Chumash peoples. We honor and pay respect to their elders and descendants, past, present, and emerging, as they continue their stewardship of these lands and waters. We acknowledge that settler colonization resulted in land seizure, disease, subjugation, slavery, relocation, broken promises, genocide, and multi-generational trauma. This acknowledgement demonstrates our responsibility and commitment to truth, healing, and reconciliation, and to elevating the stories, culture, and community of the original inhabitants of Los Angeles County. We are grateful to have the opportunity to live and work on these ancestral lands. We are dedicated to growing and sustaining relationships with Native peoples and local tribal governments, including, in no particular order, the Fernandino Tatiam Band of Mission Indians, Gabrielino Tongva Indians of California Tribal Council, Gabrielino Tongva San Gabriel Band of Mission Indians, the Gabrielino Band of Mission Indians, Kisa Nation, Yuhavitiam of San Manuel Nation, San Fernando Band of Mission Indians, Coastal Band of Chumash Nation, Gabrielino Tongva Nation, Gabrielino Tongva Tribe. To learn more about the First Peoples of Los Angeles County, please visit the Los Angeles City County Native American Indian Commission website at lanaic.lacounty.gov. Thank you so much.
Thank you, Ari. Now at this time, Danza Azteca Social Affiliate will provide us a blessing of the building for us. Thank you so much for that. Well, it's my pleasure today to welcome you all to the ribbon cutting. Today, we celebrate the completion of Phase 4 and Phase 5, adding 3 critical facilities to the Restorative Care Village. This building, a 96-bed psychiatric subacute facility. Around the corner, a 32-bed residential withdrawal management, and a 24-hour UCC. Now, I have a whole list of things I can read up here to tell you what all these things, but all these people in front of me who are going to speak, I think are going to talk about that. So what I really want to talk about is how we got here, how the vision was brought about. Instead of working in isolation of how we used to do our services, we decided to bring everything under one house, a restorative care village. So we are not doing things in isolation anymore. Behavioral health, healthcare, housing, and other supports to help residents move forward towards recovery and stability. I lost my place. Also, as you guys drove in, you could see that there's another facility that's being done as well. And that is 296 beds of affordable and supportive homes being developed in partnership with Century Housing, connecting housing with services and amenities that support residents' health and stability. So we're not done yet. There's still more to come. We're celebrating here, but we're going to celebrate even more when you have 296 beds that are part of the Restorative Care Village. So I look forward to that. Now, how we got here. This vision began nearly a decade ago when Supervisor Hilda Solis authorized the 2017 motion that launched the restorative care effort. Over her tenure on the Board of Supervisors, she has continued to advance the vision, helping move this project from a concept to a growing continuum of care. Today's ribbon cutting adds another essential component that continuum and reflects years of leadership, collaboration, and an investment by Supervisor Solis and the many county, state, community, healthcare partners who have helped bring this vision to life. Please join me in welcoming the leader behind this vision and one of the county's strongest advocates for more comprehensive approach to health, behavioral health, and homelessness, Los Angeles County Board Chair and 1st District Supervisor Hilda Solis.
Thank you. Good morning, everyone. It's good to see so many of you. I know this has been a long journey, and I want to thank all of our partners who are sitting here in the front row, but also those of you that have been with us through thick and thin and understanding what this vision means. Today, we have reached a major milestone in transforming the Los Angeles General Medical Center campus. This is a campus, and it is so large and is so vast. And there are so many things that I could talk about, and I'm sure people here in the audience could talk about the historic part of this campus. And just behind me, as you see the iconic building, the General Hospital building, that says a whole lot right there. But what we're doing today, I think, is really acknowledging our county partners, our community advocates, and our stakeholders whose dedication and collaboration have helped bring this moment about today. And I'm so very, very proud. You know, 10 years sounds like a long time. It's already going to be the end of my term in the coming months. And it really does take hard work and vision and commitment. And it really takes a strong backbone, I would say. And not just amongst my staff and me, but amongst all of us here at the county. Sticking with this one idea, this one concept that we could deliver for our communities. And I say that because it does take a village. And guess what? This is the Healthy Village. Give yourselves a round of applause, please. You heard a little bit already what the Healthy Village will contain, where housing, healthcare, mental health services, and supportive resources will all come together to serve the whole person, including, if necessary, their families. It includes the ongoing transformation of the historic General Hospital and the development of the Restorative Care Village, a first of its kind continuum of care designed to address some of the most complex challenges facing our local residents here in LA County, and especially here in Boyle Heights and this particular Northeast area. For too long, as you know, people have been experiencing mental health challenges, substance abuse disorders, homelessness, and they've cycled between emergency hospital departments, the streets, and a justice system without access to sustained care needed to recover. I imagine the Restorative Care Village to be a place to address all of those challenges and needs, and it will continue to evolve by bringing together mental health services, substance use treatment, recuperative care, and supportive housing, all to be found on one campus. Imagine that, and creating a pathway to stability, recovery, and long-term well-being. And we began this back, most of the work in 2021, with the opening of the first recuperative care center and crisis residential treatment program that provided a safe place for individuals to recover, stabilize, and connect to ongoing support systems. Today, we're expanding that continuum of care here today with the opening of these two new critical facilities. The first is the Mental Health Urgent Care Center, which will provide immediate access to mental health services for adults and adolescents experiencing a crisis. And it will be operating 24 hours a day, 7 days a week, to connect individuals to timely care in an appropriate setting while helping to reduce unnecessary visits to our emergency hospitals, not just this one here, but around the county, and that will help to save taxpayer funding. I need to reiterate that because I think that is often lost on people. The facility will include a 32-bed residential withdrawal management program, providing a safe and supportive environment for individuals beginning their recovery. Substance use disorders, as we know. In other words, this particular center will be a sobering center. And we know that we need to have more of those centers around and across the county. Residents will have access to medical care and treatment, connecting to long-term support services. And we're also celebrating the completion of the psychiatric subacute facility, which will provide 96 beds for individuals who need long-term mental health treatment and support. These beds, I know firsthand, will be so critical in helping to ensure individuals transitioning from our hospitals, our state facilities, diversion programs, and other settings, and will have access to care necessary to achieve lasting stability. It's truly at the heart of the Restorative Care Village that we bring this approach here. Today's milestone will also build on the momentum we celebrated just last week, as you heard, at the groundbreaking ceremony for the second phase of the Colibri Restorative Care Village across the street. And you can see it from here. We're going to see two phases. The first phase has already been completed, about 150 units of affordable, 100% housing, affordable housing, and supportive settings with services, wraparound services, community amenities, outside parklets, things of that nature that bring communities together. We want to bring more people back to this particular part of the county, and why not? The people here and this community have been through so much, and they deserve that. The housing component, as you know, is essential to recovery because lasting stability both requires care, but it also requires a place to call home. That's why we've made these investments. They represent, in my opinion, a fundamental shift in how we respond to behavioral health needs by investing in recovery, in treatment, and in long-term support services, instead of relying just on crisis responses and even incarceration. Most importantly, for me and I think the community and the groups that we have been working with, this helps us represent hope, esperanza, a future ahead, and hope for individuals working toward that recovery, and hope for the families seeking support for loved ones, and hope for the future in which every resident has access to the care and services that they need to heal, recover, and thrive. And I sincerely want to thank all our partners here today, and especially I want to thank my staff that has been committed, some of who are here and some that are not, that have been with me almost the last 12 years and going through this journey, because it does take strong personalities, diligence, and I would say innovation. So I want to thank my staff, if they could please be recognized and stand. Thank you. Si Wakas, Guadalupe, my chief of staff who's not here, Cindy Chin, and many, many others who have helped bring us to this moment today. I also want to thank publicly our county departments, our community partners and advocates, and residents who made this vision a reality for us today. It is just the beginning. There's still a lot more to come, and while I may not be here physically in my position as supervisor, I will be around, and I will help in any way that I can to secure more support and funding wherever I go. You should know that, that is something that I am constantly thinking about. Today, I want to recognize some of the partners who have helped make the project possible by presenting each organization with the scroll, and you've received your scrolls, but as I call your name, I would ask that you please stand and be recognized by our audience. The California Department of Healthcare Services, thank you so much on behalf of your office and the governors. The Los Angeles General Medical Center, please, staff, stand and be recognized. Los Angeles County Chief Executive Office and our CEO. Thank you. The Los Angeles County Department of Mental Health, one of our true leaders here today. Los Angeles County Department of Public Works, thank you for all that you've done. All of you, please stand. Everyone has had a hand in this. Thank you. These are our stewards. Los Angeles County Department of Public Health, please stand. Thank you. And most importantly, our Health Innovation Community Partnership. Please stand, all of you that have been a part of this journey with our office throughout the following decade. Thank you. Panco Builders Smith Group, please stand and be recognized. Abbott Construction, SWA Architects. And again, to all of you, I want to thank you all for being here and helping us envision what can be tomorrow for our communities. This is a model that I know will help to revive not only families and communities, but also provide dignity and respect to the people who live here and to those that have passed, that have come through this way. And you saw the blessings that was just given by the Aztec dancers. That was done purposefully, because years ago, there was a scar upon this area because there were people's lives that were taken. There was sterilization, forced sterilization, things that were unheard of, that today we need to remember and say that we are cleansing those spirits and bringing in new spirits and good well wishes for everyone. So I want to thank my staff and everyone, in fact, for putting this beautiful event together. I can't wait for you to go in and to see and explore what's inside. And I also want to acknowledge our LA County Sheriff who is here, Mr. Luna. Sheriff Luna, will you please stand and be recognized? He will be playing a big role in helping us address mental health as well. And I know that that's at the heart of what he wants to do. So with that, I'll turn it back to our MC. Thank you so much. Muchas gracias.
Thank you, Supervisor Solis. I'd like to bring up Rosa Soto now. Wait a minute. Rosa Soto, Director of the Wellness Center and a HICP member, would like to make her comments.
Good morning, everyone. Oh, what a beautiful morning. The weather is cooperating. It's not so hot yet, so hopefully we'll get you all out and inside and getting some good beverages and really exploring this beautiful building. As was said, my name is Rosa Soto. I'm director of the Los Angeles General Medical Center Foundation and the Wellness Center. I'm excited to be here to share in this celebration with all of you of the incredible services coming to life in RCV 4 and 5. We're standing on sacred land of our ancestors, but also on the grounds where many people in our community gave birth and received care, like our women and children's. With this history came a dark era, as Supervisor shared, in our healthcare delivery. And women, Mexican, American, Latina women in particular, were sterilized. When we went to the community with the idea of taking this land that was county land to repurpose it, right? Many of them were in disbelief and distrust. How can you tell us you're going to bring new services in when you have boarded up buildings and dilapidated services? What can you promise us? And some even said, not in my lifetime. I don't think it'll happen. Well, thank God Chair Solis is at the helm, and it did happen. And it's happening, and we're in completion of 5 phases of this incredible restorative care village. And as you said, Supervisor, not just your leadership, but the leadership of this entire county community that has really embraced a vision of a healthy village. For us, at the community level, it was important to have a say, right? And the opportunity that you gave us was the opportunity in 2017 of starting the Health Innovation Community Partnership. That has helped guide every phase of this project from a community's perspective. There are things that are very specific to how you build services, and the county does that well. The enhancement of the community is to ensure that as we deliver the services, it is culturally competent and connected. So the opportunity we've really seen is to learn what the services are and to embrace our community in engaging how they would like to receive services, how they would like to participate, and how our services connect to our broader community. So the opportunity for us has been one of community engagement, informing some of the built environment of the buildings, some of the art, right? When you said healthy community, healthy village, the community said, we want it to be uniform with this campus, not with USC, not with a new outside entity that may come and not know the community. We want this to be our community, and that is what the county partnership has provided. So for us, in 2020, you mentioned the blessing today. In 2020, we were in the thick of the pandemic, and some of you were here with us, our CEO, Jorge Orozco, and a number of us. We didn't have many people we could bring then. It was very strict. And we did a cleansing, right? A cleansing to transition the energy before the building came down. We also worked with the unhoused individuals that were wandering around these buildings and made sure that they had services and were connected to housing. We also ensured that we informed the art and informed the, again, connector of services, right, for this community. And so our work continues. We're excited about the opportunity of a trauma center and a medical campus coming to life as one of the largest workforce providers in this region to become a major economic driver. The opportunity here is to share today the importance of the needs that we have for our community, as well as the vision, right, that has been collected through the Health Innovation Community Partnership and through Supervisor's vision to ensure that in the future, we don't always need to go out to the community to ask, because they've already told us and they're at the table. And the at the table piece is the thing I want to leave you with. When you do engagement, one of the things that we ensure we always talk about is the importance of ensuring that we give people a place at the table. Not just ask them, but invite them to be part of the process. And that's what you have done, Chair Solis, and we appreciate you, and we should appreciate the county departments. I do also just want to again acknowledge, we have a lot of our founding members that are here. Monica Alcaraz, Aria Arambula, Diego Rodriguez, Yolanda Duarte White. I'm looking around to see so many of you. Please acknowledge that this is close to 500 meetings in the last decade, so it's a lot of commitment. And just appreciating everyone again for being here to celebrate, and we continue the work with you. So thank you so much.
Thank you, Rosa. Next, please welcome Rahid Sabah, Chief of Federal Grants with the California Department of Healthcare Services.
Good morning, everyone. What a beautiful facility this is. Of course, we're all here at the ribbon cutting, but I think I saw a huge bee here also flying around, so I think they want to be also part of this. I know we're trying to kind of stay away from that as well, but it is so beautiful. I'm so happy to be here. I want to give you a little bit background about the BCHIP funding, which is the Behavioral Health Infrastructure Funding. We invested about $20 million in BCHIP funding to this facility, which we're really excited about. Again, the work you all have done. As Supervisor Solis, you mentioned all the wonderful work you've all been doing. I think there was like 500 meetings. That's an insane amount. We know that, and how much time it takes and energy. So as from DHCS, we just want to show how appreciative we are for all the work you've been doing. But as a background, in June 2022, DHCS awarded BCHIP Round 3, which is the Launch Ready grants totaling about $518.5 million in funding to projects that have been through planning process and ready for project implementation. So today, the County of Los Angeles has delivered, and the California Department of Healthcare Services is really proud to celebrate this ribbon cutting for the LAC and USC Mental Health Rehabilitation Center project. It is also a privilege to join in this moment of progress and partnership. I'm here representing DHCS and really honored to share the remarkable achievement that you all have accomplished together, and we also feel really grateful to be in partner with you on this. This project will expand behavioral health facilities and resources provided to thousands of individuals every year that will further strengthen our behavioral health system in California. So it's really exciting. I really hope you all take the time to recognize how hard you work. Again, Supervisor Solis, I really appreciate that you recognize the staff, the partners, but I really also just want to add that sometimes in the midst of all the work we do, the day-to-day, whether you're on the ground level, whether you're on the administrative level, boots on the ground, it doesn't matter. We kind of tend to forget where we are, the work we're doing. So I hope you take the time to pause and recognize how much work you've actually done. And you're actually going to be saving lives, not just the people who's been affected by it, the individuals themselves, but you're really helping generations. It really is truly a ripple effect, and I've been to several ribbon cutting, and every event is so different, and just being able to see the clients, their family, and the difference it makes is huge. So I hope you really take the time to recognize that. I know you're still in the early phases, but once the work begins, you'll really, really see the changes it really makes. So again, give yourself a pat on the back when you get that time. So thank you to the County of Los Angeles for your vision, your commitment, and your bold leadership. And thank you to all our partners for everything you've done, for your unwavering dedication to expanding behavioral health access and infrastructure to every Californian. On behalf of DHCS, we extend our deepest gratitude to the County of Los Angeles and to everyone who assisted, because together we are building a future where every Californians have access to care, to support, and the healing that they deserve. Thank you.
Thank you, Aida. I'd now like to welcome Los Angeles County Chief Executive Officer, Joe Nikita.
Thank you, Damien. Good morning, all. Well, this is too high. He thinks I'm really tall. I'm glad someone mentioned the bee, because I have done a couple things, public speaking, that I'm not proud of. I've fallen off an altar. I have fallen off a stage. But if that thing flies near me, you will see the third most embarrassing moment of my life. For those in the county, you know, I'm in the middle of budget. Like we're gearing up for our supplemental budget. County's budget is pretty tight. And I don't typically do anything during budget. I got my box of red pens. I'm striking out. There's a lot of no's, some yeses. I got one green pen. But I moved my schedule around. I did not want to miss this event. This is a celebratory event, and it's one of the things that, as a county leader, and I know all our county leaders here are in agreement, this is what makes the work worthwhile, is seeing these things come to fruition and turning a campus. This campus didn't look like this 10 years ago. And Supervisor Solis, you said 10 years seems like a long time. It is a long time. I had 2 kids when you started this project. I now have 3 kids and the youngest is 9. I mean, that is a long time. And today's ribbon cutting does represent this multi-year and multi-agency effort. And I'm looking around here and I see state partners, I see a lot of county leaders, I see CBOs and community partners, and this is really a beautiful event and a beautiful thing for us all to come together and do something that's really meaningful, because these beds will help people stay out of jail. They will help keep people off the street. And I was talking to Supervisor Solis's staff member, Wakas, who I think many of you know, and he was just really gushing about the opportunities on this campus to go from crisis at the urgent care center to housing at the housing that was celebrated last week. So it is a really amazing campus and an amazing place. I do want to give a special thanks to Supervisor Solis. I mean, she has been such a tireless advocate. It is difficult to bring these types of large-scale projects to fruition, especially over this timeline. A lot of things happened since you passed the motion, Supervisor, COVID being one of them. But we took advantage of COVID because one of the funding streams that we leveraged for these projects is American Rescue Plan Act funding. So that was so we're very thankful for that. We want to thank our state partners as well. I mean, there's a lot of state grant money, and they've helped us secure some federal money as well. This particular phase, I believe, has over $145 million in state facilitated grants that have come to make this project happen. Without that money, this would not have happened. We would not be sitting here today celebrating. I want to thank our department heads. I know they'll get an opportunity to speak. I see Kelly LoBianco back there, who is incognito. Thank you for all the work that she's done as well. Dr. Wong, Dr. Brian Hurley from SAPSI, who helped, along with Supervisor Solis' staff, bring this project to fruition, and of course, our Public Works Department, Angela Georgia Moody, and thank you to our sheriff for being here. I've seen him 2 days in a row. I'm not in trouble. We just happen to be at some similar meetings. So I want you, if you could, just honor all of these leaders with a round of applause again, please. They've done a lot. I would also ask you to honor the folks who are in the background, who are doing, maybe they worked on a site plan, or Damian Parker, who, did so much to help bring this to fruition, or maybe they worked on finance for the project. They did some community outreach. These are folks who were essential to this project, but they're the unsung heroes of the county. They come to work every day. They're trying to do what's right, and I wish that you give them a really, really big round of applause to thank them as well. So I'll just close by thanking you all for being part of the ribbon cutting. When this event is over, take some time to walk around, please, the campus. And I hope you will feel like I feel a sense of enormous pride for what the county has been able to do under the leadership of Supervisor Solis, and really feel like you're part of what will hopefully be a long-term solution to many of the county's issues that we have today. So thanks very much.
I'll see. Thank you, Joe. Next, I'd like to bring one of my favorite people in the world, but she's my boss, so I don't have to say it, but I'm going to. Please welcome Dr. Lisa H. Wong, Director of Los Angeles County Department of Mental Health.
Thank you so much, Damien. Good morning, everyone. I am really so thrilled to be here today with you to celebrate this monumental milestone for Los Angeles County. I want to extend my deepest gratitude to the Los Angeles County Board of Supervisors but specifically our hero, our champion, Chair Supervisor Solis of the 1st District. I'd also like to give deep thanks to our many partners, including Dr. Christina Galli and the Department of Health Services, Dr. Barbara Ferrer and the Department of Public Health, Mark Pastrella and his awesome team at the Department of Public Works, the incredible design build team of Smith Group, Pankow Builders, who brought this beautiful LEED gold certified space to life. So many partners to thank, Rosa, Yolanda, to bring that community involvement to life and make it not just a checkbox. That was so invaluable for this project. So as someone who started her career as a student in Skid Row, my focus has always been on caring directly for those who need it most. And I've been really proud to spend most of my life actually in the county where this is its mission. And I think today this physical space is the manifestation of a commitment to that mission to serve those who need our help the most in the county. And at the Department of Mental Health, we meet our most vulnerable residents where they are, and our hope is to be able to walk alongside them on their path to stability, dignity, and recovery. Historically, mental health crisis services and substance use withdrawal treatment operated really in separate worlds. This facility intentionally shatters those silos by bringing acute behavioral health and residential withdrawal management under one single supportive roof. This restorative care village provides a compassionate alternative to crowded ERs and criminal justice involvement, ensuring that people in crisis receive specialized, trauma-informed care. This 35,000 square foot facility is carefully structured to manage a vast spectrum of complex co-occurring needs safely and with respect. On the ground floor, we have a mental health urgent care clinic providing rapid up to 24-hour crisis stabilization and assessments, featuring a dedicated capacity of 32 adult chairs and 8 adolescent chairs, including separate entrances and designated treatment areas for adults and adolescents to ensure maximum privacy, safety, and comfort. And also, it's equipped with specialized entry points for emergency transport and first responders. On the second level, there's a residential withdrawal management offering medical social model managed withdrawal care, featuring 32 dedicated adult beds for short-term stays, seamlessly transitioning individuals from immediate 24-hour stabilization downstairs into structured substance use recovery upstairs. That is going to be a game changer. Additionally, to support the continuum of care, the Restorative Care Village has a new psychiatric, subacute, and acute facility with a total of 96 beds. And what it took to get here, I can't even begin to tell you. I want to thank our state partners for helping us and supporting us along this arduous path. But these 96 beds represent the most needed level of care in the county. And the facilities also represent a massive leap forward in our countywide push for health equity. It's a safe harbor designed to serve people who have fallen through the gaps of our healthcare system for far too long. Many of you may not know this, but my husband was actually born at this hospital on this campus. He was the son of immigrants from El Salvador, and at that time, it was a place of uncertainty and fear many times. And now we have this opportunity, especially with our Aztec blessing to kick us off, we have this opportunity to change this into a campus of hope and restoration. Restorative Care Village Phases 4 and 5 will integrate directly into our broader emergency infrastructure, working alongside our psychiatric mobile response teams and our 24/7 helpline to streamline referrals. So thank you to the dedicated clinicians, case managers, peer specialists, and community advocates who will breathe life into these halls starting tomorrow. And thank you to our brave providers who are taking that leap of faith with us. We don't know what we would do without you. And thank you again to Chair Solis for her unrelenting dedication to and passion for serving our communities. And I'd also like to give some acknowledgement to our own DMH team who has fought tirelessly. And when I say fought, I mean fought tirelessly to see this come to fruition. We have Jacqueline Balcom here, Senior Deputy over Health Access Integration. We have Damian Parker, who has overseen everything, Al Logan. So many of our DMH folks really believed 100% and put in extra hours to make this a reality. So this is truly a reason to celebrate today, to be able to do this ribbon cutting. Together, we are building a healthier, more resilient, and more compassionate Los Angeles County. Thank you.
Thank you, Dr. Wong. Next, I'd like to welcome Dr. Brian Hurley, Interim Director of Los Angeles County Department of Public Health, Substance Abuse Prevention and Control Program.
Good morning. What a day to celebrate this opening of Phase 4 and 5 of the Restorative Care Village. I'm Brian Hurley. I'm an addiction psychiatrist, and I'm here representing the health department. And I want to add the health department's voice to the chorus in celebrating this achievement. This achievement represents so much, but I want to tell a story that's somewhat personal. 25 years ago, I started medical school at the medical school just up the street. I trained in the county hospital. The building is still right behind me. And, you know, I'm an addiction psychiatrist. I'm interested in working to help people with substance use problems and to work to support people with mental health conditions. And I would see people in the hospital, and then I would ask, so where are the substance use services exactly? How do people get specialized mental health services? And historically, we sent people away, right? The idea was this is where you went, you got stabilized, and then you went away. I look now at this campus, which frankly is unrecognizable from what I experienced 25 years ago, right? There's a new county hospital that opened up, many years ago, but now, right, we have these substance use and mental health programs physically here on campus, helping to realize the bringing together of services to people rather than expecting people to go out to services. So I do want to talk a little bit about the residential withdrawal management on the second floor of the building just right behind me, right? The residential withdrawal management facility is a 32-bed facility. It'll be operated by our partners at the LA Center for Alcohol and Drug Abuse, LA CADA, which we think as being a really key partner. And this, you can think of withdrawal management as the beginning, right? It's the beginning of a recovery journey that gives people a safe space to come off of the substances that they're using under medication management, supportive services, and then connection to community. And that connection can be housing, that connection can be ongoing care. There's a lot of different pathways to recovery, but this is a door for people to go through. And it's a really important opportunity to create that door here on campus. I think the vision is that we bring together services where people are, right? The integration is that people receive the right care at the right time at the location where they need it. And what better manifestation of that is than bringing these services together here on campus. There's a lot of people to thank, and I'm not going to continue to enumerate the thank yous that have been offered by my colleagues. But I do want to offer a particular note of gratitude to Supervisor Solis. Thank you for the opportunity to realize this vision with you and for the county. And I also want to thank our Department of Public Health staff members, particularly Anton Moore and Marcia Ellis, and a number of other Department of Public Health, Department of Mental Health employees that have worked together to make this possible. So thank you. In conclusion, we're better offering services where people are, integrated care at the point where people seek services, and we're really, really glad to be able to bring this vision together here today. Thank you, everyone, for your time and attention.
Thank you, Dr. Hurley. Next, please welcome Angela George Moody, Chief Deputy Director, Los Angeles County Department of Public Works.
All right, good morning, everyone. I, like Joe, have this thing about bees. So if I move to the right or the left, just bear with me. I promise not to move off of the stage. Oh, the sheriff will rescue me from the beetle. Thank you very much. So once again, good morning. And on behalf of Director Mark Restrella, who unfortunately couldn't be here today, and all of us at Los Angeles County Public Works, we want to really thank you, Supervisor Solis. Yes, thank you for your leadership and really for bringing all of us together to celebrate this momentous milestone. I also want to thank our partners from the Department of Mental Health, Public Health, Health Services, our CEO, and of course, Dr. Wong, you, for your partnership and once again bringing this vision to life. I think that is the theme of today. This is a vision that is becoming reality. Today, I think a lot of us heard, is about much more than opening 2 new buildings. It's about these buildings making possible things, these buildings making things possible for the people we serve. Phases 4 and 5 of the Restorative Care Village will expand access to mental health, behavioral health, and substance use treatment. It's not in my speaking points, but on my way here today, I explained to my mom where I was going. And I'm hearing from everyone that it resonates, that how important this is. My mom said, hey, Angela, guess what? I did my mental health training at that hospital. This is before I was born. She actually started. And I was like, wow. And her comment, Supervisor Solis, was, well, why couldn't you take me with you? I'm learning. But really, the RCV is going to provide care and support to some of our most vulnerable residents. At Public Works, we strive to be the builder of choice for Los Angeles County. That means being a trusted partner to our county departments and delivering facilities that they need to carry out their missions. This is one of them. These projects demonstrate exactly what that commitment looks like. The Phase 4, because I'm not sure if everyone knew this, component of this project was recognized by the LA branch of the American Society of Civil Engineers as its project of the year. And both phases of these projects have significantly exceeded their local worker hire requirements. Most notably, Phase 4, it more than doubled its local worker hire target, coming in at 66.8%. And it nearly tripled, thank you. And it nearly tripled its targeted worker hire requirement of 27.4%. Phase 5 exceeded its local worker hire requirement by 16%. So we are paying attention to the people, the needs of the people. And I'm really proud to say that Public Works delivered both projects early and under budget. Joe, early and under budget. Thank you very much. Director Pistrella often reminds us that infrastructure is ultimately about people. Being the county's builder of choice means turning the county's priorities into places that improve people's lives. The Restorative Care Village is a great example of that mission in action. I want to say congratulations to everyone who helped make today possible. And with that in mind, I want to say thank you.
Thank you, Angela. And our last speaker of the day, I'd like to bring up Jorge Orozco, CEO of Los Angeles General Medical Center.
Good morning, everyone. What an honor to be the last speaker. Guadalupe, thank you for giving me a half hour to talk about LA General and its many accomplishments. But really, it is an honor to be here. You're hearing about all our partners and how it really does take a village to move a vision forward. And Supervisor Solis, thank you so much for your leadership around this. And I want to take an opportunity to go back where this all began. Because for me, this moment is very meaningful. I still remember when Supervisor Solis came to LA General early in her tenure and challenged our team with a simple but very important question. How can LA General reach farther into the health of our communities that we serve? She was asking us to think differently about how and what a medical center means to the community. I want to acknowledge Dr. Brad Spellberg, our Chief Medical Officer, and our LA General team that began putting this vision on paper. And we asked, what happens after we save a life? What happens after we stabilize an illness or treat an immediate crisis? What if mental health, substance use treatment, recovery services, supportive care, housing could all be connected on one medical center campus? And that became the foundation for the Restorative Care Village. And we did not build this vision alone. We went into our communities. We were in Boyle Heights in the evenings, El Sereno, City Terrace, Chinatown, and beyond. And we listened and we heard the concerns and we answered the hard questions. And the community helped us make this vision better. And what emerged was truly unique. This is a first in the nation mental health and well-being campus built around the needs of a whole person. And this is not simply a vision for the future. It's already here. It's already serving people. And today, this building is the next step in the continuum. So instead of asking people in crisis to navigate disconnected systems, we are bringing all those systems together around the person. All on one medical campus, all connected, and all focused on recovery, dignity, and a path forward. So Supervisor Solis, years ago you asked us to have a greater impact on the health of communities. Today we can look around this campus and we can see this answer. So to everyone who helped bring this day into reality, our community partners, Dr. Spellberg, the entire LA General team, thank you so much. And together we are not simply building new facilities, we're building a new model for how our nation can care for people. Thank you so much.
Thank you, Jorge. Thank you, everyone speaking. Can we give everyone a round of applause who did speak today? I'd like to give out some special announcements. Abbott Group, SWA Architects, Prisa, Trevor, Pancow, Smith Group, without your efforts on a daily basis, and without you guys getting yelled at by Prisa constantly, this would not happen, right? This doesn't go unforeseen. We appreciate the efforts you did. We are, I'm not going to say how much under budget, but we are under budget and on time again. And that's an effort from all of you. Every day, all day, being able to make this happen, and I applaud you guys. Okay, we forgot to mention that there is a plaque down below on the corner of Zonal and Mission, and let me read what it says. honoring healing, remembrance, and strength for all those affected. We remember the women whose futures, families, and choices were taken from them through forced sterilization. May this place of healing serve as a sacred promise that the rights, health, and dignity of our communities will always be protected. That will be a plaque on the walking path on the corner of Mission and Zona that will always stay there. Okay, thank you to our county and state partners, community organization, healthcare provider, project teams, and everyone else who made today possible.